You guys, when you talk about preoperative workup and things that nobody else talks to you about and things we watch out for before we get you on the table. I'm Dr. Angelina, board certified surgeon, and we need to talk about this. So you see all the TikToks and Instagram and whatever videos about surgery and how people get it and so cute and that's great. But nobody really talks about how we're going to prepare you for surgery and things to watch out for. So number one, preoperative anemia, undiagnosed anemia, untreated anemia, iron deficiency anemia. So in some of the studies, it showed if you have certain decreased level of, let's say, hematocrit less than 36, then your post-operative recovery becomes much rougher. Rougher. Anyways, increased risk of bleeding, therefore potential for increased risk of blood transfusion after surgery, which you do not want if you do not need, trust me. Higher chances of pneumonia, higher chances of wound infections and healing problems. Higher chances of bleeding in surgery. So before surgery, when we check your blood levels, I like to get them few weeks before surgery. That way, if there's a problem, we can treat it and get your levels where they need to be before actual surgery, rather than find it as a surprise the day of surgery or not even know about it because then it's too late. So some places that you go to, they only do your pre-op like literally the day of surgery. If that happens, there's no way they're going to treat you anemia. They're either going to cancel your case or do unsafe surgery. Number two, obstructive sleep apnea, untreated or undiagnosed. That's when you snore at night. That's when you wake up and you're still tired, potentially taking little naps during the day or being very sleepy. Most of the time, people are overweight and obese, but it can happen in people who are not overweight as well. We do know that some of the GLP-1 medications are approved by FDA for treatment of obstructive sleep apnea, but not everybody actually gets to treat it, and some people really try to get into the surgery way before that problem is taken care of. So the odds of complication with obstructive sleep apnea that is untreated are much higher, meaning higher chances of pneumonia, higher chances of cardiac problems. There's one study that showed, that was published in JAMA, that patients with obstructive sleep apnea had risk of post-operative complication at 19.6% versus 1.3% in patients at low risk category. So if you have obstructive sleep apnea, you go into higher risk category patient. 19.6% rate of complications versus 1.3 if you don't have sleep apnea. The estimate is about 10 to 20% of patients that go under knife do have obstructive sleep apnea. Those are the patients that can potentially have that problem. Three, thyroid function. You have to make sure your regular doctors at your annuals checking your thyroid function. If you have any issues, symptoms that can be potentially hypothyroid issue, that needs to be addressed and checked. Full thyroid panel, not just like one or two numbers like a lot of doctors do. Why? If you have untreated hypothyroidism, you have higher chance of having hypothermia on the table, hypotension, which is low blood pressure, and delayed wound healing. So low temperature, hypothermia, is a big deal in surgery. Like in surgery, it's one of the things we watch out for. We want to keep our patients warm. We have those bear huggers, those like things that blow hot air on you while you're asleep. We have all kind of gadgets and things that we monitor you with to make sure temperature stays normal. If the temperature is not controlled and you become cold in surgery, you're more likely to bleed. So blood will not clot, which is kind of a problem when you're cutting somebody open. And of course, post-operative complications go up. So one thing leads to another. So hypothyroidism leads to, if it's untreated, leads to problems in surgery like bleeding, which can lead to transfusions. Non-healing wounds can heal to wound infections and all kind of problems, right? And we're also going to have trouble controlling your blood pressure in surgery. When we cannot control your blood pressure in surgery, well, that can lead to cardiac complications as well and other issues. Undisclosed vitamins, supplements, powders, or whatever peptides that you just forgot to tell the doctor about, right? Why is that a problem? Some of them will make you bleed. A lot of the over the counter vitamins and supplements will make you bleed, and you want your doctor to know about it. That way we can stop it like ahead of time, couple weeks prior, so we don't have to take that extra risk of bleeding, right? One of the highest risk of surgical complications is infection and bleeding. We do not want you to bleed. So tell us if you take that shit and let us know so we can tell you to stop it. Other things, it can make problem in anesthesia department, meaning your medications will interfere with anesthetic, and then you either not getting the anesthetic that you need, or you're not waking up from anesthetic that you got. And that's also a problem when you're like, hello, wake up. And you're like, nope, thank you. I still have medication on board because it didn't get processed correctly because of the supplements I took. And therefore, we're going to take a longer nap, which can lead to other problems. Don't forget about your GLP-1s and other peptides. GLP-1s decrease your stomach emptying. And if it's not stopped ahead of surgery, it can lead to having food in your stomach, which we do not want when we're putting you to sleep. If you start puking that stuff up, it can lead to aspiration pneumonia, that's food getting into the wrong pipe and causing pneumonia, obstruction, like major complications, potentially needing you to be intubated in the hospital, and potential death. Now, I know there's no way we can really 100% test everybody for cardiac pre-existing conditions, but it's always good to go to your doctor and get your annuals and make sure that they, cardiac test you. If you're at higher risk population, history of smoking, certain age, certain pre-existing conditions, we usually try to get EKG and cardiac clearances. Why? Because if you have semi-obstructed or almost obstructed vessels, or you're at high risk for some kind of arrhythmia, you want to see that cardiologist before you see me. You want them to take care of that problem, potentially give you a cardiac stent or whatever, before we do anything cosmetic or whatever other surgery we're talking about, right? Heart is more important. Undiagnosed, untreated diabetes, poor sugar control, poor glycemic control leads to complications. You will not heal the same. So in cosmetic surgery, if you don't heal the same and you are extra sweet, meaning your sugars are all over the place, well, it's a problem because bacteria loves that sugar. So if you have an open wound because you're not healing well and you still have undiagnosed or untreated diabetes, that bacteria will attack it, and you can have humongous necrotizing infections that spread literally in front of your eyes and can lead to major hospitalizations and unaliving. And the last one is any kind of undiagnosed or undisclosed mental health disorders. You do not want to go into major surgery when you're fully not prepared and your provider, your medical doctor, your surgeon is not prepared for it. We do try to screen for that, but sometimes we cannot, right? So you definitely want to get appropriate therapy, appropriate medications on board, appropriate expectations of surgery, especially talking about cosmetic surgery. If somebody has undisclosed disorder, you will never be happy with surgery potentially, or you will be um, not prepared correctly for the surgery and then have horrendous recovery from mental standpoint, which can lead to other issues with healing. So we really want to know everything about you when we're getting into surgery so we can prepare you correctly and work with you correctly, not to not give you surgery, because I've had seen that before. People like, well, I don't want to tell you that I have this problem. What if you're not going to operate on me? The worst I'll say, hey, why don't you go see a psychiatrist and get me a clearance, right? That nothing bad. Like we want you to get the best health advisory behind you. So make sure you don't get discouraged. Mental health is health. It has to be addressed the same way we're talking about cardiac health and any other health. So obviously comment, like below, tell me your experiences in preoperative situations, how you dealt with them, how your doctor dealt with them, and have you ran into any kind of problems if you had undiagnosed disorders?